Alzheimer's disease is known to many of us as that condition that robs our loved ones of their memory and so much more as they age. But as scientists learn more about the mysteries hidden by Alzheimer's, there is hope that treatments can be developed that can slow the progression of this condition and also possibly help the people affected by it live longer and better lives. We have an Alzheimer's expert here today to answer your health questions next on Dr. Q&A. Hi, everyone, and welcome to Dr. Q&A. I'm Olga Villaverde, and joining me today is our expert, Dr. Ian M. Grant, who is an assistant professor of neurology at the Feinberg School of Medicine at Northwestern University. We're so happy to have you, Doctor. Thank you so much for joining us on Dr. Q&A.
All right, thanks, Olga.
Before we get started, I just want to remind our viewers that if you do have a question for our expert, all you have to do is maybe email us or give us a call. This is the information. Email your question to questions@allhealthtv.com. You can also call us at 855-796-4475, or you can send in a question by your cell phone and upload that video to our website, allhealthtv.com. We'd love to hear from you. Okay, doctor, so let's get right to it. I have a question from Andrew, and Andrew has a video question about the keto diet. Let's take a look.
Hi, doctor. Functional medicine doctors have said that the keto diet can reverse, reduce, even stop a lot of the symptoms of Alzheimer's. And what I'm wondering is that in fact true? Are there any studies that suggest that the keto diet can have this lasting impact?
Great question from Andrew, doctor.
Yeah, thanks, Andrew. So there's been a lot of interest in the ketogenic diet for lots of different neurological conditions. Some people might be most familiar with it as a treatment option for certain forms of epilepsy, especially in children. But it's thought to have possibly some benefit in certain neurodegenerative conditions. So far, there haven't been any large-scale clinical trials looking at these sorts of diets to show a clear kind of benefit. However, there have been mouse studies as well as some other animal models that suggest there could be some benefit from a ketogenic diet. There have also been some case reports that suggest there could be some benefit. But as it stands right now, I would say there's not enough evidence to clearly recommend it to patients at this point.
For some of us that don't know what the keto diet really entails, can you talk about that and maybe some foods that you yourself recommend that some patients actually eat or maybe stay away from?
Yeah, so there has definitely been a fair amount of research when it comes to diets in general. And a ketogenic diet is a diet that is designed to generate something called ketones in our bodies. So our normal primary energy source is glucose. That's what the cells of our brain like to use. But in certain states, especially if we're consuming low amounts of carbohydrates, our body starts generating ketones actually from fat. And these ketones can be used as an alternative energy source. Now, when it comes to some of the other diets that have been looked at, what has been found is that a Mediterranean-style diet actually seems to be one associated with a lower risk of cognitive decline over time. And so for those not familiar, a Mediterranean-style diet is one that is higher in healthy fats, so like what you might find in fish, nuts, olive oil, and then also has plenty of vegetables, especially leafy green vegetables, and then emphasizes more whole grains rather than refined sugars. There have also been some diets that have been developed, or that are being developed, I should say, that combine elements of the Mediterranean diet and others. So there's something called the MIND diet, which stands for the Mediterranean-Intervention for neurodegenerative delay, and the DASH diet is a diet that stands for dietary approaches to stop hypertension. So there's plenty of evidence to show that high blood pressure, hypertension, especially even earlier in life, can be associated with a higher risk of developing neurodegenerative disease like Alzheimer's disease as people get older. And so controlling that from an earlier age may have some benefit. So the thinking is that if you can combine these sorts of things, you may have even added benefit. And there are ongoing research studies to try to find if this is in fact true.
And doctor, real quick, what about sugar? Sometimes we hear that it can make patients worse, even with cancer. And obviously we're talking about Alzheimer's. What's your thoughts with sugar?
Yeah, so I've generally been one not particularly advocating for super restrictive diets, completely cutting out any particular nutrients. And there's been some research that suggests that high carbohydrate intake can be associated with difficulties in multiple different organ systems, but the nervous system too. And I think the thing to probably keep in mind is that moderation is key. I don't think that there's significant evidence to show that sugar in and of itself is a particularly detrimental thing for the brain. But just as with most things, large quantities of them are certainly not going to be good.
All right, thank you, doctor. We have a question from Dean. So let's take that question and see what he wants to know. What are the 3 things people can do to slow the progression of Alzheimer's disease? Great question, Dean. Doctor, your thoughts, please?
Yeah, so thanks, Dean. There have been some large-scale trials, both done in Europe and currently ongoing in the US, to look at different sorts of lifestyle interventions that might be helpful to slow the progression of Alzheimer's disease in individuals who are already showing symptoms of it. So one of these interventions we kind of just talked about, and that's diet changes. So instituting a Mediterranean-style diet or this MIND diet seems to be one thing that can help. Another probably bigger thing is actually physical exercise. So we know that people who get a lot of regular physical exercise on a regular basis do significantly better over time, potentially almost as well as the benefit that can be gained by certain drugs that are already out there. So the more physically active we stay, it seems like the better off we are in the long run in terms of disease progression. And then a third thing that I would mention is doing things that keep our minds stimulated and active. So not that there's anything inherently wrong with watching television, but doing things a bit more active, less one way in nature is a good strategy. So definitely anything creative like music, art, those sorts of things, but even just reading, doing puzzles, playing games, especially games that you might engage with other people doing, those are great things as well.
I remember when my girls would visit a center near our home with some elderly people with Alzheimer's, they would dance and sing, and it was just amazing to see how they would be very still, and within a few minutes they would start partaking with the girls, and it was very magical, to be honest, doctor, to see something like that.
Oh yeah, and just the social component of these sorts of things play a huge role too. I mean, I just know that in my own patients who I've been seeing over the past year, unfortunately, the pandemic has taken a particular toll on many of them, largely because of just the increased isolation that a lot of people experience, and people who may have dementia and benefit from having more contact with others really seem to have a little bit more decline over the past year or so. And there have been some studies that have shown this to be the case. And it was just a very difficult situation because we also know that this was a population that was very susceptible to complications from the virus itself. But then a lot of the precautions that were necessary also had detrimental effects. So fortunately, now that things are starting to get a little bit better in that regard, a lot of this social side of things has started to come back, and people have started to show some benefit from that again.
Amen to that. Okay, doctor, I have a question. Actually, I have a few questions from Steve. He's packed a few in, so let's get to all of them. How important is getting enough sleep in preventing Alzheimer's disease? How much sleep is enough? And do Alzheimer's patients tend to sleep a lot during the day? So lots to talk about here, doctor.
Yeah, so it's a very good question, Steve. So to answer the first part, with respect to the importance of sleep in terms of preventing or delaying Alzheimer's disease, there was actually a study within the past year that was published that found the importance of sleep even from a younger age. So people who earlier in life had a history of inadequate sleep, insomnia, just not sleeping enough, they were at definitely a higher risk of developing Alzheimer's disease as they got older. And part of this is thought to be that sleep is very important for sort of the housekeeping of the cells in the brain, because degenerative diseases like Alzheimer's disease are caused by accumulations of abnormal things, and sleep is something that may help prevent this accumulation from happening sooner rather than later. Now, the question as far as what's enough, that's going to vary somewhat from person to person, but a general good rule of thumb is that most people on average need somewhere between 8 to 9 hours of good restful sleep at night. And some people get by on less, some people think they get by better on less, but for the most part, 8 to 9 hours is usually a good amount to shoot for. The other important thing to keep in mind is that there are lots of common sleep disorders in the US that get more common as people get older. So some people may have heard of sleep apnea, which is something where your breathing is affected while you're sleeping. And these individuals may seem like they're getting enough sleep because they're sleeping through the night, but then they're very sleepy during the day. And the reason for that is that the abnormal breathing at night is preventing their brains from really reaching these deeper, more restful stages of sleep that are important for brain health. And it just makes it that much harder to function during the day then too. So the key there is, oh, sorry, go ahead.
Oh, no, sorry, I'm doctor. I was just interested because 8 to 9 hours, I mean, I'm literally, chatting with my supervising producer who's sending me questions. This is how technology works now. She's like 8 to 9 hours. Oh my goodness, who can even get that anymore? Does it really work? Is it really necessary? I mean, I know some people that go on four, maybe 5.
So I think it's a good aspirational goal. So that's 8 to 9 hours is probably not going to be realistic for a lot of people. But if you try to shoot for at least about 8 hours or so, I think that's a reasonable and hopefully attainable goal for most people.
All right. Just a reminder, viewers, if you'd like to ask a question to our expert, really easy to do. You can email that question or give us a call. There's our phone number, 855-796-4475. Email questions to questions@allhealthtv.com. And don't forget, you can also upload a video and go to our website, allhealthtv.com. Okay, doctor, as we continue, before we get into symptoms, which I think is important to talk about, I want to watch this story from the Mayo Clinic about a man diagnosed with Alzheimer's, and apparently he is not letting the disease get in his way. Let's take a look.
Meet Burke, a 71-year-old from Arizona diagnosed with mild cognitive impairment, often a precursor to Alzheimer's disease. Like many people in his situation, uncertainty grows as his memory becomes a concern.
And I cannot tell you when it began to happen because, it just happened slowly.
But as a lifelong lover of the outdoors, Burke wasn't going to let his condition slow him down. He decided he would literally take a different path.
It's something I've always wanted to do. I love living in Arizona. It's where I became a Christian. It's where I fell in love and got married. All my kids have been born here. So I said, sure, I'll do the Arizona Trail.
The Arizona Trail is a popular and rigorous trail that links Mexico with Utah, covering 800 miles of Arizona deserts, mountains, canyons, and forests. It's a challenge for even seasoned hikers.
Why don't we all go hike the Arizona Trail? He makes it sound so easy, right? 800 miles.
Dr. Richard Caselli is a neurologist with Mayo Clinic who specializes in the study and treatment of neurologic conditions that lead to memory loss, including Alzheimer's. Dr. Caselli said that while every patient is different, their journey with these conditions is often influenced by their outlook.
When you're confronting something that could be an early stage of Alzheimer's, of course there is worry. What's going to happen to me? until that glorious day when we have a cure or something we can meaningfully do to prevent it from getting worse, the best we can do is to try to encourage people that their life is not yet over.
This is my new life. Am I going to be good with it or not? I can't change it. So I said, you know what? I'm going to be good with it. And I'm going to have a positive attitude. And if I forget things every once in a while, so what? You try to do better the next time, and you just keep going.
He, to me, really is the epitome of the encouragement that I try to give my patients of not giving up on life, continuing to live. From a number of health studies in general, not limited to dementia or Alzheimer's, people with positive attitudes tend to do better.
You're coming at the end of the day, and you got another pass that you need to go over. You got to go up. Got to go up to 2,000 feet or more. There's a sense, do you have it? Are you going to do it?
My goodness, doctor, what an inspiration. And I do believe that positive thinking works miracles, don't you?
Oh yeah, no, that's a great story. And the kind of take-home point there about not letting these sorts of diagnoses or diseases define what you can and can't do, especially early on, is very important. I mean, I always counsel my patients that, just because this diagnosis that you have now doesn't mean that you need to preemptively stop doing the things that you enjoy doing. And especially like in this gentleman's case, getting out, hiking a lot, being outside, he's really checking those boxes for physical activity, which is great. And, people who are doing the things that they love and staying positive, that really does make a difference in terms of both the disease symptoms and just the ability to cope with the changes as they come.
Doctor, I was reading here talk about an Alzheimer's blood test that can diagnose the condition many years before it starts showing symptoms. Can you talk a little bit about that and what you know so far?
Yeah, so there's been lots of hope for some sort of simple blood test that could potentially diagnose Alzheimer's disease at an earlier stage, not just to be able to, accurately tell a person what they're dealing with, but also for the purposes of developing treatments and therapies to make sure that doctors know that they're actually treating what they think they're treating. So the idea behind the blood test that's been and is being developed and is being used in multiple different research studies already is one that measures the levels of a particular form of something called amyloid, which is one of the abnormal proteins that accumulates in the brains of people who develop Alzheimer's disease. And the thinking is that this accumulation probably starts up to 15 to 20 years before a person ever even develops symptoms. And so if one might be able to detect abnormal elevations at some point before the person has symptoms, especially if there's something that's identified that's an effective prevention strategy, you might be able to just simply get a blood test and start some sort of therapy. Because as it stands right now, we can measure the level of this amyloid protein. We just can't do it in the blood. We have to do it in what's called the cerebrospinal fluid. So that's the fluid that circulates around the brain and the spinal cord. And you can get measures of that to accurately diagnose the disease. But of course, that involves something called a lumbar puncture or a spinal tap, which, although it's not quite as bad as many people make it out to be, it's still a procedure. And just a simple blood draw would be preferable for a lot of people.
Yeah, I would take a blood draw over a spinal tap any day, doctor. Question here from Kaylee. It's a few of them, so let's get to them and then we'll answer them one by one. Do Alzheimer's disease cognitive symptoms come and go and accelerate rapidly? And then she has a follow-up here. What are some of the symptoms, which we talked a little bit about, doctor, memory issues. I'm assuming they sleep a little more, so chime in on that. And then I'll ask you the next one after this.
Sure. Yeah. So the question about onset of symptoms and how quickly they progress. There's a lot of variability between people. Some people when they start developing symptoms, the progression of symptoms tends to be sort of quick from one year to the next. Other people, it seems to be much more gradual. And what we typically see, though, is that the rate of change tends to be fairly consistent within any given individual. So, if a person's early symptoms seem to progress relatively quickly, we probably, unfortunately, predict that that would continue to be the pattern. Versus somebody whose symptoms were progressing gradually from the beginning, we'd probably anticipate that they would continue to progress gradually over time. Now, the question, I think there was also a part in there about whether they come and go. And from one day to the next, there may be some variability. Everyone's allowed to have good days and bad days. And sometimes all it takes is a really poor night's sleep the night before, some minor illness like a cold or some other kind of infection, recovery from an injury. Any little thing can sometimes make it that much harder for the brain to continue to compensate for the disease that's there. And so that can sometimes result in some worsening of symptoms kind of in the short term. But the general thing that we see is more of a general trend for a gradual decline over time, rather than a lot of ups and downs. Now, as far as the specific symptoms go, again, there can be variability between people. Far and away, the most common early symptom is simply short-term memory troubles. So this would be things like repeating the same question over a short period of time, forgetting details of recent conversations, misplacing things more often, forgetting how to get to places that maybe used to be familiar. These are the very common kind of early symptoms. And the reason for this is that these abnormal proteins that accumulate in the disease, the area in the brain that's most susceptible to them is the memory center of the brain. And that's why most people just have short-term memory loss as an early symptom. However, the symptoms really depend entirely upon what parts of the brain are being affected early on. And there's a fair amount of heterogeneity in that, lots of variability. So people may develop primarily word-finding troubles as an early symptom. And that might happen if the language center of the brain is what's being affected early on. So maybe the memory seems okay, but they have more trouble coming up with words in conversation, and communication starts to become hard. There may even be individuals who develop more visual spatial troubles. So they have a harder time making sense of what they're looking at. And their eyes work just fine, but the part of their brain that's important for processing that information just doesn't work as well. And so that can sometimes be an early sign in certain individuals too.
And Doctor, we only have about 4 minutes left. I want to get to a few questions. One really quick from a viewer. Do they sleep more? Do patients with Alzheimer's sleep more?
Yeah, especially as the disease progresses, it's quite common to see that there's more fatigue associated with that, and that people are napping a bit more during the day. It just takes less to kind of exhaust one's energy. But you also want to make sure that there's not some primary sleep problem affecting the quality of sleep at night that's making a person more tired during the day too.
And Doctor, treatments for patients suffering from Alzheimer's, what are there today, and is there anything promising in the future?
Yeah, so the current medications that exist have been around for quite a few years, and some people may have heard of these. Something called donepezil, also known as Aricept, is one of the most common ones. There are a couple others that are similar to it, and then there's a different acting medication called memantine, also known as Namenda. The net effect of all of these types of medications is to slow down the progression of symptoms over time. They unfortunately can't affect the underlying pathology in the brain, but they do seem to slow the decline over time and help people retain more independence for longer. Now, the question is to what's on the horizon. There are many different approaches that have been and are being investigated. Probably the biggest area of research right now, just in terms of numbers, is looking at medications that can actually remove some of these abnormal proteins, the amyloid from the brain. And so there have been some promising results from some early clinical trials to suggest that perhaps if you remove this amyloid from the brain, especially at earlier stages of the disease, perhaps you can even further slow down the decline. So far, nothing looks, unfortunately, like it's a full cure, but I think it's going to be a matter of attacking the disease from multiple angles, not just the amyloid alone, but possibly also some of the inflammatory components of the disease that are going on in the brain, as well as some of the other neurodegenerative pathologies that can coexist.
And Doctor, I got about a minute left, and I really want to get these two questions in. So maybe in sound bites, if you don't mind, but they're important. Clinical trials, the importance of clinical trials for people to get into. And again, the caregiver, some words for the caregiver and final thoughts, because we have to remember them as well.
Yeah, so with respect to clinical trials, I think that that's a great reason to get diagnosed early on if there's a concern for memory problems, because the first person to be cured of Alzheimer's disease is going to be someone who's part of a clinical trial, and so being in some sort of clinical trial is very helpful, not just for potentially the individual, but also for finding a cure in general. Now, as far as caregivers, this is probably one of the biggest issues with the disease, that there's lots of time and effort that needs to be spent caring for older relatives, whether that's a parent or a spouse, and obviously there are other care obligations that might be present too. So it's very important as a caregiver to make sure that you're also taking care of yourself and looking for the resources and support that can benefit you too.
Doctor, thank you so much for all the information. Such an important topic. We hope to have you back soon.
Thanks.
And that's all the time we have for Dr. Q&A today. We hope to see you next time. I'm Olga Villaverde, and you take care.
The Health Channel wants you to have all the answers you need to be in control of your health.
Infection and the virus keeps coming back.
That's why, in addition to Dr. Q&A,
if treated appropriately, the patient should...
You can always chat with one of our health advisors through our free service, Ask Hannah. Just go to allhealthtv.com or download the Health Channel app and get the answers you need.
No question should ever be left unanswered. Remember, if you don't know where to start, ask Hannah.